That little plastic card could save you euros 10,000. One of the biggest anxieties for any expat living on the Costa del Sol is healthcare. You pay your taxes, you're a resident, but if you have an accident and show up at a hospital without the right documentation, you could face a bill for thousands, or even tens of thousands, of euros. Understanding the system isn't just a bureaucratic exercise, it's fundamental to your financial security here. There are 3 distinct paths to healthcare coverage in Spain, and the one you take depends entirely on your residency and work status. The first and best option is the public system, accessed with a SIP card, the Tarjeta Sanitaria. This is free at the point of use if you qualify. The second path is the Convenio Especial, a state-run pay-in scheme for residents who don't qualify for the free system. The third is private health insurance, which is mandatory for many visa applicants, and a popular choice for those seeking faster access or English-speaking doctors. Over the next few minutes, we are going to break down exactly who qualifies for each, the precise steps to apply, the real costs involved, and the common mistakes that get applications rejected. Getting this right is not optional. So, who gets free access to Spain's excellent public healthcare system? The answer is simple: anyone who is actively contributing to the Spanish social security system. This is the core principle. The most common way to qualify is by being employed by a Spanish company. Your employer automatically deducts social security contributions from your salary, making you eligible for a SIP card. The second route is being registered as self-employed, or autónomo. As long as you are up to date on your monthly social security payments, which start at around 80 euros per month, you and your registered dependents qualify. The third category is pensioners. If you receive a Spanish state pension, you are covered. For British expats, this also includes those receiving a UK state pension who have correctly registered an S1 form with the Spanish authority, IEs. We will cover the S1 form in more detail later. The key takeaway is that the SIP card isn't really free. It's an earned benefit, TIE, directly to your financial contributions to the state, either currently through work or historically through your pension. If you are not in one of these groups, you cannot simply walk in and get a SIP card, no matter how long you've lived here. Getting your hands on the SIP card involves a strict 4-step administrative chain. There are no shortcuts, and you must complete them in the correct order. First, you need your NIE, the Número de Identificación de Extranjero. This is your foundational Spanish identification number. Second, you must register on the Padrón at your local town hall or ayuntamiento. This is called the Empadronamiento, and it's your official proof of address. When you use it for your healthcare application, this certificate must be less than 3 months old, so don't use an old one. Third, you must be registered with the Social Security System, the INSS, or Instituto Nacional de la Seguridad Social. For employees, this is automatic. For autónomos, or S1 holders, this is a distinct registration step. Fourth, and only after the first 3 steps are complete, you can go to your local health centre, the Centro de Salud, to apply for the card itself. You will need to bring your passport, your NIE document, your Empadronamiento certificate, and proof of your Social Security registration, or your S1 form. They will process the application and give you a temporary paper document on the spot, which grants you immediate access. The physical plastic card usually arrives by mail within 2 to 4 weeks. What if you're a resident, but not employed, not self-employed, and not a pensioner? This is common for early retirees, or those on a non-lucrative visa after their first year of mandatory private insurance. For you, the solution is the Convenio Especial. This is a special agreement where you pay a monthly fee directly to the government for access to the public healthcare system. To be eligible, you must have been a registered resident in Spain for at least 12 continuous months. You cannot apply for it the moment you arrive. The cost is age-dependent. As of early 2026, the fee is 60 euros per month for residents under the age of 65. For those 65 and over, the cost rises to 157 euros per month. It's crucial to understand what the Convenio Especial covers. It gives you full access to doctors, specialists, and hospitals. just like a regular SIP card. However, it does not cover prescription costs. You will have to pay 100% of the price for any medications, which can be a significant ongoing expense. You apply for the Convenio at your local TGSS, the Tesorería General de la Seguridad Social, not at the health centre. For many non-EU expats, private health insurance isn't a choice. It's a mandatory requirement for their residency visa. If you're applying for a non-lucrative visa, a student visa or a golden visa, the Spanish consulate will not approve your application without proof of comprehensive private health insurance. And not just any policy will do. It must meet specific criteria. It must be with a company authorized to operate in Spain. It must have zero co-payments or deductibles. And it must cover all medical services, including hospitalization and repatriation. Standard travel insurance is never accepted. The cost varies significantly with age. A healthy person under 40 might pay between 50 and 80 euros a month. For someone between 40 and 55, expect to pay 80 to 130 euros. Once you're over 60, premiums often jump to over 180 euros per month, and some insurers may not even accept new applicants over 65. Major providers you'll see are Sanitas, Adeslas, DKV, and ASA. This private policy is your only safety net for at least your first year, before you might become eligible for the Convenio Especial. Once you've lived here for a while and have your SIP card, you might wonder whether to cancel your private insurance. Many long-term expats on the Costa del Sol choose not to. Instead, they adopt a hybrid approach, keeping both public and private coverage active. This strategy offers the best of both worlds. The public SIP card becomes your safety net for major issues, emergencies, serious illnesses, planned surgeries, and managing chronic conditions. The public system is robust and free at the point of use for these critical events. At the same time, you use your private insurance for conven, IELTS, and speed. Need to see a GP or a specialist like a dermatologist or a cardiologist quickly? The private system can get you an appointment in days, not months. It also provides easier access to English-speaking doctors and can offer a more comfortable experience with private rooms in hospitals. This dual system allows you to triage your own care. A sprained ankle? Go to the private clinic. A heart attack? Go straight to the public hospital's emergency room. This gives you control, reduces wait times, and provides peace of mind, all for the cost of a monthly private premium. It's frustrating to follow all the steps, only to have your SIP card application rejected. Let's cover the 3 most common reasons this happens and exactly what to do. First, insufficient social security contributions. You might apply a few days after starting a new job, but the contribution from your employer hasn't registered in the system yet. The solution is simple. Wait. Give it another month for the payment to process fully, then go back to the Centro de Salud and reapply. Second, you went to the wrong health centre. Healthcare is geographically zoned. Your assigned Centro de Salud is based on the address on your Empadronamiento e-ento. If you go to a different one, they will reject you. The solution is to check your Padrón certificate, find the correct health centre for your address, and apply there. Third, your documentation is out of date. The most common culprit is the Empadronamiento e-ento certificate, which, as we mentioned, must be less than 3 months old. If yours is older, you must go to the ayuntamiento and get a new one printed before you apply. If you are genuinely rejected and believe it's an error, you can file a formal appeal, known as a reclamación, at the regional offices of the Servicio Andaluz de Salud, or SAS. For UK citizens living in Spain, the rules have changed since Brexit, but one key document remains critical: the S1 form. If you are a UK state pensioner, the S1 form is your golden ticket to accessing the Spanish public healthcare system, paid for by the UK's NHS. It effectively makes you equivalent to a Spanish pensioner in the eyes of the healthcare system. However, simply having the form is not enough. You must formally register it with the INSS, the Spanish Social Security Office. Once registered, the INSS will issue a document confirming your right to healthcare, which you then take to your Centro de Salud to get your SIP card. It is vital to confirm that your S1 is properly registered. You can do this by calling the INSS directly. For non-pensioners, the rules are the same as for any other non-EU citizen. If you are a UK citizen working in Spain, either employed or self-employed, your social security contributions grant you access. If you are not working or a pensioner, you must have private insurance, or after 12 months of residency, apply for the Convenio Especial. The GHIC card is for tourists on short stays only. It is not a substitute for resident healthcare.